Welcome to today's Leadership Series webinar. I'm Bruce Lloyd, GAHE's Executive Director, and we're looking forward to Chuck Stokes' presentation on leadership imperatives in a post-COVID-19 environment. Today's program offers 1 hour of qualified education credit from ACHE. You can add your credits on ACH website in the My ACHE section. Just a few announcements before we get started. Here's some upcoming virtual meetings. On January 21st, we have our monthly virtual lunch and learn with face-to-face credits. Disruptive healthcare, disruptive innovation in healthcare delivery, and that's from noon to 1:30. And March 22nd through 25th is ACHE's Congress on Healthcare Leadership. So be sure to mark your calendar for those events. And you can register for all events at GAHE's website, gahe.org. Before we get started, I'd like to recognize our annual sponsors. Platinum sponsors are Wellstar and Stegenga and Partners. Our gold sponsors are Cancer Treatment Centers of America, Protivity, Metro Atlanta Ambulance, Philips Healthcare, HCA TriStar Division, Beck Group, and Sound Physicians. And our silver sponsors are DT Spade, KCA Firm, SSR Inc., and Nagel and Associates. I'd also like to thank today's Leadership Series sponsor, Apollo MD. And it's my pleasure to introduce Amy Katnick, Chief Operating Officer of Apollo MD, who will introduce our speaker. Amy, you want to take over?
Absolutely. Thank you. And hello, everybody. Hope you're doing well today, on Wednesday. While working at a previous company, I had the opportunity to support the management of the emergency medicine practice at North Mississippi Medical Center, while our speaker was president for the system. Ever since meeting him, he's someone whose career I have followed with interest, and it was no surprise at all to me that in 2019, he was named one of Modern Healthcare's 100 most influential people in healthcare. If you've read his bio, you know that Chuck Stokes has 4 decades in leadership experience in healthcare, and he's led 2 separate organizations for Malcolm Baldrige Awards, with the mantra of focusing on operating and hardwiring models for quality, patient safety, and consumer-centric care. But what you may not know about him is that prior to his C-suite positions in several large systems, including most recently system CEO at Memorial Hermann in Houston, Chuck Stokes started his career as an orderly at a 75-bed hospital in Yazoo City, Mississippi, and he worked himself way through nursing school as a scrub tech in the OR. Since his pathway was similar to my own and that he has truly learned healthcare from the ground up, I thoroughly enjoyed hearing about his journey to leadership, and it was apparent that he's an inspirational leader and the accolades are very deserved. In our conversation regarding his introduction, I was further impressed by his insight and vision into the future, that he is on the leading edge of innovative thought process. He was and is developing transformational changes in leadership structure and diversity in leadership teams, while obtaining buy-in with the inclusion of each group's intentional and deliberately vetting of all decisions. And in breaking news just yesterday, it was announced that Mr. Stokes has just received another acknowledgement of his contributions and achievements. He was named this year's Healthcare Sector Award recipient for Leadership Excellence from the Baldrige Foundation. It is my pleasure and privilege to congratulate and introduce Chuck Stokes as today's leadership speaker on behalf of Apollo MD for the Georgia Association of Healthcare Executives. Thank you.
Great. Thank you, Amy, for those very kind words. And I want to thank Bobby and Bruce and Larry, Tyler, and Amy all for sponsoring me today, and certainly Apollo MD. I greatly appreciate the sponsorship. And it's good to be back with you all. It's I think it was maybe almost a year ago that I was with you in Atlanta, or maybe a little more than a year ago. And we had an opportunity, I think at that time, to talk about high reliability and where we were going as a topic. And so today, what we're wanting to focus on is employee and workforce engagement and also physician engagement. And because one of the things I think is going to be one of our biggest challenges on the other side of the pandemic is an engaged workforce, including to include our medical staff. Now, I have to say, as a disclaimer here, one of the things, and I feel a little bit hypocritical about this, is to say leadership imperatives in a post-pandemic COVID-19 environment, because I personally have never led a single day in a COVID environment. As many of you know, I retired in December of 2019. And that was not because I was an anticipatory leader or I was clairvoyant or any of that. It was just, I was lucky and I ended up retiring, and I did not have to go through what you all are facing today. And I applaud you for doing it. And I actually do not know how many of you are leading organizations with all the stress with this pandemic. I am staying in touch with a lot of our peers across the country, because I do a lot of really what I call comfort coaching to many of our executives across the country, because they can pick up the phone and call me, and I'll be an empathetic ear when they can't fuss at their board chairs and their other leadership within the organization. But you know, one of the things that that I have also found in listening to many terrible stories about this pandemic is I have also been very optimistic about the ability to accelerate change when push came to shove, with things that you're having to do and things that in the past that would have taken us months and months and months to make a decision on. And it seems like the COVID environment has said, nope, you don't have months, you have to get this done in the next few days. And we have figured out a way to do that. And we have developed this sense of urgency that our industry has liked for some period of time. I think a lot of us, and I'm generalizing, have lacked a sense of urgency to really initiate change that we know that we have to do to be a sustainable industry. And so today, what I want to focus on are some of the issues around employee and physician engagement and how we go about dealing with these things. Now, we had a lot of stresses before the pandemic. We were concerned about financials. We were concerned about bad debt, charity care. We were concerned about partnerships. Were we big enough to succeed, et cetera, and social disparities. But, and we had other issues. We had workforce burnout, we had nursing shortages, we had primary care physician shortages, and other ancillary shortages prior to this pandemic. And so how are we going to deal with a lot of these going forward? So let me just pause to take a minute and let you reflect on a couple of things and think about your stress during this time that you've been working for this past year with this pandemic. You've got kids, many of you have kids out of school. Now, I don't have, all my kids are all, Judy and our children are grown and they're out, but I can't even imagine what it would be like to have to homeschool a child. I mean, for me, I would have to have medication. And I can't imagine how the majority of our workforce, and especially given that the majority of our workforce are women, how they are dealing with this in addition to trying to hold a job. Many of you are having to deal with taking care of elderly parents, and whether they live in the house or they live in the same town or they live in another town, and you're trying to coordinate care. Many of you have probably had a spouse or a partner that may have lost a job, or it could have happened to someone that's on this webinar that you've lost your job. And then just the social isolation from friends and support systems. I mean, we just come off a holiday season, and I can tell you, I mean, in our family, Thanksgiving is really our biggest holiday. And we did it virtually because nobody could travel. I mean, we had kids on the West Coast. I had kids in Germany. I had kids in Baton Rouge. But we said, hey, the right thing for us to do is to socially isolate So we had a Zoom Thanksgiving celebration. And so when you think about all those and being away from things where you derive strength, your churches, your synagogues, your mosques, that where you interacted with people and you got another source of strength. All of those things have been disrupted. And so my wife and I were planning on doing a lot of traveling when we retired. Little did we know that, that this pandemic was about to hit. And so when you look at all these stressors in your life, and then you look at the stressors in the workforce, it's no wonder that we are just totally stressed out and burnout. And so one of the things and this first bullet here about according to a Gallup poll in 2019, I recall getting that those poll numbers right before I retired. And that number said that less than 37% of our workforce was actively engaged in their work, which means 63% were not actively engaged. And so when you think about that, that's a fairly staggering number, because many of you, I know most of you from our conversation a year or so ago, were on a journey to high reliability, because we know that quality and safety is very important. And can you think about, if you only have 37% of your workforce that's actively engaged, what are the implications on that for your journey to high reliability? You think about a nurse that is a oncology nurse that is given chemotherapy every day to people, and they're stressed about their kids' education, their parents, their sick parents, and they're coming to work and they are not actively engaged in their work. And what are they doing? They're giving some of the most dangerous medications to the sickest patients that you could possibly deal with. And so the implications for that are enormous. And that's why, again, the engagement piece to me is so important. We're still going to be concerned about financials, and we're going to be concerned about bad debt, charity care, and all that. But when we're on the other side of this pandemic, the engagement piece is something that we had a problem with prior to the pandemic, and now we're going to have to deal with that in a post-pandemic world. So the loss of productivity, I don't even remotely know how you calculate the loss of productivity if you only have 37% of your workforce actively engaged. And then burnout is rampant. And we had this was a problem before the pandemic. And these numbers, the 35 to 54% of physicians and nurses were manifesting symptoms prior to the pandemic. That number has only accelerated. And I actually saw that number in the 56 to 75% just a few weeks ago in a publication. And so we know that we're going to have to deal with that in a post-COVID environment. We have to deal with it now, but we're going to certainly have to deal with it in a post-COVID environment. And then just the strained relationships with senior leadership. And again, there's no value judgment about what I'm getting ready to say, but and this may or may not be applicable to your organization, but many organizations across the country, and I've talked to several of these, if their organization did not provide appropriate PPE or staffing during this pandemic, or they had their benefits cut, or their pay cuts, or layoffs and furloughs, all of those kind of things generate some pretty strong feelings with the workforce and with their leadership. And so we have to deal with that. And we should start, again, trying to be anticipatory in dealing with those things now. How are we going to mitigate some of these ill feelings about our organization leadership and the organization itself from our workforce and our physician? And then, as I alluded to earlier, just the stress from social isolation of family, children, and friends. And this is just the mental health issue of being in your house all the time. And I can say, I regard myself as kind of healthy person, but I can tell you that just being cooped up in your house, only an occasional outing, is something that creates a lot of stress. And then the stress from social unrest and the lack of civility within our country. We cannot ignore that. That is something that we are going to have to come to grips with now and for many years to come. But it is an issue that overflows into the workforce and into the workplace. And I'm going in a little later on in the presentation here, I'm going to talk about diversity, equity, and inclusion, because if we're going to have an engaged workforce and we're going to have a progressive workforce, we're going to have to deal with the issues of diversity and inclusion. And diversity, a lot of us have been dealing with that for many, many years. And that is really just having a seat at the table. But inclusion is about really giving your employees a voice at the table. And then belonging is about having that voice heard. And so these are things that are essential. Belonging is essential for engagement within the organization. And we're going to have to come to grips with that. So Bruce, if you can, next slide, please. And so as we move towards, that's it. As we move towards, the mitigation factors about how do we have an engaged employee workforce, a key to that is we have to have an operating model that is going to keep us sustainable for the long term. Now, when you look at, I think the numbers are still fairly close to the same, but you look nationally, most of us operated on somewhere around a 3 or 4% operating margin, but about almost 50% of the organizations in this country were at a 1% or 0 break-even operating margin, or they were in the red. And so that was, again, prior to COVID. And so we have to have an operating model that is hardwired into our DNA within the organization. It is part of our culture. And it is amazing to me as I talk to healthcare professionals across the country today is, well, tell me about your operating model. And it's like they really can't articulate it. And especially organizations that have done well and they have a fairly robust operating margin and they've got money in the bank and everything. It's like, well, as long as all of that is working well, the governance stays off their back, and they're pretty pleased with that. But when you ask them to articulate the model, what is your model, and does everybody in the organization know what your operating model is? Tell me what that is. And so I'm amazed that we really don't do that. But I would like to just say that, again, as Amy kind of introduced, part of my background for the past 15 plus years, I've been very engaged in Baldrige, and not necessarily from the standpoint of winning awards or winning, being recognized as an award winner, but the Baldrige operating model is a framework for sustainability of your organization. And so it is all about when you have engaged employees and physicians delivering high quality, safe care, high reliability care, exemplary customer experience, you don't worry about your financials, because if you're doing those 3 things right, you will have the financials to continue to invest in your organization and continue to grow. All 5 of those are inextricably linked to each other. But I will tell you, for watching this for many, many years, if you don't get the first 3 right, if you don't get the engagement of employees and physicians and high quality, safe care, exemplary customer service, you will not get the financial sustainability right either. And so, and again, I would just, since we are, here in Georgia, congratulations to Candace and John Keevan Wellstar as one of this year's Baldrige recipients. Just outstanding achievement and outstanding commitment. But these are the things that you're going to have to do in order to create a sustainable organization going forward. And you can't just get into it and then say, here's another crisis, let's kind of move away from it. It has to be hardwired. Your operating model has to be hardwired into your organization. And the reason is because we have to move out of this role in healthcare, and we've been doing this for decades. It's always about incremental tinkering. We have to get to transformational change. We cannot afford to just incremental tinker in making change. And the one thing, again, that the pandemic has done, it has showed us that we have the capability of creating sense of urgency and changing faster than we thought that we had. But for the future, it's not, incremental tinkering is not enough and is not going to make us sustainable. Next slide. So prior to the pandemic, again, what did we deal with? We dealt with workforce shortages, and we're going to deal with workforce shortages in post-pandemic. And I'll talk a little bit about that in a minute. So here comes back to anticipatory leadership. What is plan B? How are we going to deal with that? You can't just keep paying premium pay and having agency nurses within your organization and paying just crazy salaries to keep people in the workforce. You have to have a plan about how you're going to deal with that, and we're going to talk about that going forward. We were dealing with mergers and acquisitions prior to the pandemic, and I think that one of the things that we're going to see in the pandemic, post-pandemic, is we're going to see an acceleration of mergers and acquisitions again. And if it's not mergers and acquisitions, it's going to be organizations saying, I don't know that I'm ready for that, but let's look at putting together joint operating agreements between organizations so that we share things like, technology expense to become more consumer-centric in our telemedicine services, or other types of joint operating agreements, or I call them OWAs, other weird arrangements that are out there that people are going to just say, we don't want to merge, but we're going to come together to do some things together to reduce our expenses and improve efficiency within our organization. And then the financial stress from low reimbursement. We are still continuing towards value-based reimbursement and value-based care. And we have to figure out, how do we learn to provide services in a more cost-effective way? You're seeing bundled payments. And now recently, you're seeing all the new legislation coming out about price transparency, going to require organizations to publish prices. And that's going to be obviously very controversial. And a lot of people get concerned that when you start having to publish prices, that's just a race to the bottom on the reimbursement. But it's out there, and we will have to deal with that as an industry. And then increase expense structures from new technology investments. We're going to have to shift our capital away from things that we have traditionally invested in. And I think most people today are saying we're not going to invest in bricks and sticks anymore. We have to invest in technology and more consumer-centric type care and technology that will advance the more consumer-centric care. Then restructuring, downsizing, reorganization. Again, I think that is really what the future is about, and we're going to have to brace ourselves to go through that again. And then rising uninsured population. Again, we've got a lot of people out of work, out of jobs, and so things like bad debt, charity care continue to escalate, and we will have to figure out, how do we deal with that? And then our increased awareness of social disparities. We knew that before the pandemic, but and as a country, we probably didn't deal with that in a very proactive way. Now, what the pandemic has pointed out is this huge disconnect between the acute healthcare sector in our industry and public health. And so things like social disparities, you don't have enough money in healthcare systems and hospitals to take on the community's healthcare disparities. You're going to have to do it in cooperation and again, in new partnerships with people like public health and people like United Way, American Heart Association, the social infrastructure within your organization. So it's going to, we're going to have to figure out these new relationships and partnerships as we move forward. And we should start that now and not wait to say we're going to wait and deal with that after the pandemic is over. Now, a lot of the things that I've talked about here is it's kind of dark, and you're probably sitting there saying, okay, Chuck, tell us something, some good news here. What is something that we can look forward to? Well, one, we have to look for the gifts in these crises, because out of crises, there are always gifts. And so what we're going to have to figure out is where are the gifts and how do we communicate these gifts back to our employees to continue to keep them engaged in the organization. So a question I'm going to just put out there, because I will probably want to ask in the Q&A here, is what is your organization doing to enhance engagement with your physicians and with your workforce today? What are you doing today? Because a lot of this is about sharing these things among each other, and there's a tremendous opportunity to share going forward. So Bruce, if you'd go to the next slide, please. So the implications here going forward for optimism about what can happen, what good can come out of a pandemic. Well, first, I want to start with conversations about governance, because this is something that this is not all the senior leadership can't necessarily be at the table with governance. But one of the things that governance and senior leadership, especially the CEO, COO, and the executive leadership in the organizations, are going to have candid conversations with their boards about employee engagement. And this reminds me of the conversation that I remember having with my board at Memorial Hermann when we got onto the journey to high reliability. This is a candid conversation. You cannot sugarcoat this conversation with your board. The board has to understand, just like when we communicated in high reliability conversation with our governance, that we are causing harm to our patients. A lot of our board members had never had that candid conversation in the boardroom. We dealt with a few of those, but we had to become very transparent, and we had to become very intentional about those conversations. And so having honest dialogue about where you are with your engagement, because a lot of times CEOs and COOs don't want to come to the board and say, we just did our annual employee and physician engagement scores, and they're not good. And they do, and you should be sharing those kind of conversations. But it's more about what can the board help you in, how can the board help you in dealing with those engagement initiatives. And you have to be candid, no sugarcoating, just very straightforward conversation with the board. And the board and the senior leadership, how can they help with engagement? They can help by minimizing downsizing, furloughs, and adverse impact of benefits. And again, these are things that create ill will among the employees. And sometimes the senior leaders just need to have very direct, candid conversations with the board to say, I know you wanted to have a 3% operating margin, but if we could live on 1 to 1.5% and not downsize or minimize downsizing and impact to benefits, and we will commit to you as senior leaders to make that up down the line when we get this pandemic behind us. Those are the kind of conversations that really go a long way with retaining engagement with the board, with your employees. And then working with the foundation. And the foundation, most of you have foundation boards in your organization, and working with them to help develop an employee assistance fund. Now, a lot of foundations do that, and many of you have probably already been down that road. But I will tell you that that again is something that would go a long way in asking your foundation to support things like childcare or mental health support for your employees for some designated period of time. I remember during Hurricane Harvey in Houston, we had 5 days of rain. There were 53 inches of water dumped on our city, and we had 2,600 employees that lost their homes. We had 2,300 employees that lost their automobiles, their form of transportation. And over that 5-day period, we made personal phone calls to all 27,000 employees. And our foundation board and our hospital board got together and said, we have to raise money. And they ended up raising like $6 million to help these employees out during their time of need. These are kind of things that employees, they just don't forget. They will remember those. They will remember those always. And so those are things that, just things to be thinking about if you're not already working on that with your board. And then what the board needs to do is set aside money and support senior leadership and supporting funding for new training programs like telehealth, home care techs, pharmacy techs, and other technical support for allied health professionals. We're going to talk about this in a little bit more detail here, but you don't have enough nurses, you don't have enough home health, home care techs. Those are all part of a future health system that has to be. And so let's start now about figuring out how do you train these individuals moving forward. Next slide. Okay, so this really has nothing to do with COVID. This is just like everyday leadership, things that we have to do, but correctly assessing the level of employee and physician engagement within the organization. I cannot tell you how many times that I have heard other leaders talk about doing their employee engagement and physician engagement assessment before they make an unpopular decision in the organization. I'm just saying, don't do that. If you've got to make an unpopular decision, make the decision, but don't hold off and then make this decision and then do an employee engagement survey. They will never forget that. Your employees and physicians do not forget those kind of things. And then you got to be honest with the results of your employee engagement survey. When you do the survey, publish the results, put it out there, and then develop a list of solutions. Here's what we're going to do to address these concerns that showed up in the employee and physician engagement surveys. And once you do that, then develop a scorecard. And just like you do for safety or quality or financials or anything else, put an engagement scorecard out there, attach it to your operating report, and say, here's the progress that we're making towards these engagement initiatives that you as physicians and you as employees identified during this survey process. Your employees, they listen, they will tell you what they need to stay engaged if you only listen. And again, the comment here, the quote here, leaders who don't listen will find themselves surrounded by people who have nothing to say. And that is so important. And being an empathetic listener as a senior leader is a skill set. And we all know that, but sometimes it's hard to do. And sometimes we forget about that. And I would tell you that leadership visibility is something that is so important. Now, I've heard this numerous times, and I've had numerous conversations about this during the pandemic. How can I be visible as a leader? And we all know that's important. And we have talked for now 10 years about getting out of your office. You can't lead from home. You can't lead from your office and behind your desk. And in COVID, I think what I've heard a lot of leaders say, I'm concerned about if I get sick as a leader and I can't lead the organization, so I need to lead from home or lead from my office. This is not about, you can put on PPE and you can go out into a hospital and you can make rounds, because the moment you step foot inside the hospital and just say thank you, what do you need? Do you have everything that you need? Do you need more PPE? Do you need more of whatever? Everybody knows that you came out. They're not asking you to go inside an ICU room where a patient has COVID and is dying. They're asking you just to be present and to show that you are interested, show that you are concerned, show that you're out there trying to meet the needs of the employees and the physicians. And they know that when you step foot in the building, that Elvis is in the building. And when you leave the building, they know that Elvis has left the building. And so it is so important about leadership visibility. Can't overstate that. Zero tolerance for leadership that does not treat the employee workforce with dignity and respect. It will kill your credibility. This is considered a career limiting move. We all have had experiences with this, but when you tolerate people that do not treat other people with respect and dignity, it is a direct reflection on you. It is not a reflection on the person that is not treating people with dignity and respect. And I saw this other quote here from Perry Belcher that said, "Nothing kills a great employee faster than watching you tolerate a bad one." We know that that's true. Quint Studer, we all know Quint, and his comment is infamous about what you permit, you promote. And so today it is really about courageous leadership. And we talk about that term all the time, courageous leadership. What are the attributes of courageous leadership? Courageous leadership is about honesty. It's about unquestionable integrity. It's about fact-based information. It is about only talking about the facts. It is about constant communication. It is about organization, being organization-centered and not centered on yourself and your own ego. Data-driven. We talk about being data-driven all the time. Our comment, in the absence of data, any opinion will do, right? So it's all about being data-driven. Timely decisions. You know, if you have to make an unpopular decision, go ahead and make the decision. There are no secrets in organizations. So make the unpopular decision and get it out there. And then the zero tolerance of people that don't treat other people with respect in your organization. It will kill your credibility as a leader, and especially during times of crisis. It's even more important. And then just being an empathetic listener. Those are all attributes of courageous leadership. Next slide. Okay, so how do we go about building this infrastructure now of engagement within our workforce? One, I'm going to just start with talking about diversity and inclusion, and I'm going to try to move along here so that we have some time for some questions. But the diversity and inclusion conversation really has to be led by the CEO or at a minimum the COO in the organization. It's not that the HR department is not facile with this information and how to do it, but it sends a message when the CEO pulls together a diverse group of people in the organization, the workforce and physicians, and talk about how to get to transformation. They will tell you that, but it has to be led, at least initially, it has to be rolled out by the CEO and the COO, and they have to make this information transparent within the organization. They have to communicate what's being discussed at these human resource groups or affinity groups. And this is one of the fastest ways to accelerate engagement within the organization. Communicate, communicate, communicate. We know that that's important. I talked about making tough decisions in a timely manner, but you can't over communicate. Again, you say it 100 ways for 100 days. That's what you have to do. The transparency is of paramount importance. And then identifying new job roles within the organization and communicating how these jobs will be filled, because this offers hope. This is just like the country, what we're going through now in our country. how are we going to get our economy back? Once we get through the pandemic, how do we get our economy going again? It's about jobs. How are you creating jobs? Same is applicable in your organization. What are the new job roles within the organization? What are the new skill set needed? Those are things, again, like consumer-centric telemedicine technology and telemedicine expertise, nurse tech roles, other technical type roles. Identifying those jobs, how are we going to train these people, and that hopefully you're going to make a commitment that you're going to offer these roles to people already within the organization to protect their jobs and to give them additional skills to make them continue to be employable within the organization. And then communicating key leadership attributes for the necessary succession within your organization. What are those leadership attributes that are required to move up in the organization? Again, things like consensus building skills, anticipatory skills, embracing equity, diversity, and inclusion, whole system thinking, high reliability skills, process improvement skills. These are things that we know that we've talked about in the past, but you're going to have to prove. The message here for you all as leaders is when we're interviewing people for these leadership roles, how do you know that they possess those type skills? You're going to have to do that through giving some type of simulation or some type of group interview process that gives them situational narratives and let them respond and see what is their ability to embrace diversity and inclusion or be anticipatory about what they need to do to resolve a problem. Next slide. So workforce succession planning in a post-COVID environment. One of the things, I am so impressed about how we adjusted under pressure during the COVID environment. And I literally have dozens and dozens of stories I could share with you, but we just don't have time to do that. And what I have to question is even my own leadership. Why didn't I do that when I was still a CEO, COO in different organizations? Why didn't we let the perfect stand in the way of the possible? Just think about, think about the credentialing process. We have credentialed physicians in 24 hours to work in different hospitals and actually in different states. And we have taken med-surg nurses and other nurses from other parts of the organization and turned them into ICU nurses in a matter of days. Or if they weren't proficient, we figured out how they lend a hand to the ICU nurses to help them carry out their jobs. So we're going to have to continue in our workforce succession planning by partnering with schools and universities. We're going to have to really lobby state boards for our allied health professionals to expand their scope of practice. This is applicable to nursing boards, to pharmacy boards, OTs, PTs, all of our allied health professionals. And this is going to be a tough sled. This will not be an easy thing to do, but we should start preparing that now. It's not really about practicing at the top of people's license. It is about redefining their license and training technical level people to do things that a lot of our licensed people are doing now so they can do things that are more important in the future. Assisting with funding of faculty positions. I know many of you do that. I've done that for decades in healthcare, and budgets are tight. But if we're going to train and get more nurses and pharmacists and respiratory therapists, et cetera, we're going to have to probably fund some of those programs. And then we're going to have to develop creative retention programs and things like nurse scholarships, nurse residencies, tuition reimbursement, loan forgiveness, those kind of things. But we might have to come to do some really creative things, like tell one of your key employees that if you have a child that wants to go to nursing school or pharmacy school or OT, PT school, we'll pay that child's tuition as long as you stay employed in our organization. and then ask that child when they graduate, they give us a year or 2 years for every year we put them through school. We're going to have to get very creative about how we retain our employees moving forward. And then developing these internal training programs, which I've talked about. And then I think that the pandemic, one thing that it has pointed out is some healthcare systems have figured out how to work together during this, and we should not lose sight of that. And maybe it's an opportunity for healthcare systems within the same community to get together and look at staffing shortages and a community response. Next slide. Reimagining your workforce. Cross-training for new skills, we talked about that. Critical care techs. There's an opportunity also to change our work environment. When you think about, we have our many of our workforce in the most expensive space in our hospitals. You think about your PBX operators, your cardiac monitor techs that are on the cardiac floors, fall monitor techs, telemedicine, your intensivists and hospitalists that are doing telemedicine for hospitalists. We can put them in a different building off campus in less expensive space and have them work from a different area because it's technologically possible to do that. And we're going to have to contemplate that. And we're going to have a receptivity to our workforce to change their environments. Look how many people we have working from home now. And we've said the place didn't fall apart. We were able to do that. We're going to have to reimagine our workforce, their skill set, and we're going to have to reimagine the space that our workforce works in. And then redefining the relationship with our medical staff. And Bruce, if you go to the next slide. Our medical staff, again, they're stressed as we are stressed, as our nurses and other allied health care professionals are stressed. Physician burnout, their loss of autonomy, their concerns about their financial viability for the future, becoming facile with telemedicine. They're concerned that not being able to physically examine a patient in their office, they're going to miss something, and that they're going to lose that connectivity with their patient with telehealth. We will figure this out. We will get better. We will get more proficient at it, and we will get more exact at it as we move into the future. But telemedicine is here to stay. That horse has left the barn, and we will never put that genie back in the bottle. So we're going to have to figure out how we do that. Physicians really still, while many more are employed, there's still anxiety about becoming employees of a health system or employees of anybody other than themselves. But my main message here is that physicians have got to be seen as partners, and physicians can be very difficult to work with, and we've all had our challenges with working with difficult medical staff. We've had our challenges working with difficult hospital staff. And so, but they are our partners. Physicians still control the majority of spending in healthcare, and nothing happens in our healthcare system until a physician initiates a physician order. So their world is changing. It is becoming more evidence-based. It's becoming more algorithm-driven. It's becoming more technologically driven. And physician extenders are changing the way that physicians practice. And we have to just say, we have to accept that they are under a tremendous amount of stress. And what we're all trying to avoid is post-pandemic here, that all of a sudden, when it's over, nurses and doctors won't leave the organization in the middle of a crisis. But when this pandemic is over, if we have not anticipated what we need to do to keep them engaged, we're going to see a lot of physicians say, I got to take a break. Our nurses, pharmacists, respiratory therapists, all saying, I got to go do something else for the future. There's a lot of opportunity to mitigate that from some of the things that we've just talked about, but we have to be more anticipatory, and we have to do it now. We can't wait until the pandemic is over and then say, oh, let's figure this out. we have to start with these mitigating factors now so that we can actually perfect them and we can be ready. We can start rolling them out now that we get better post-pandemic. So I've been rambling here now for about 45, 50 minutes. So I want to take a few questions. And again, if any of you have something that you would like to share with your colleagues here about what are you doing in your own organization to address these issues of workforce reimagination or physician, how are you mitigating physician burnout or staff burnout? I'd love to hear that, but if you have any direct questions for me, I'm happy to entertain those.
Hi, Chuck. This is Bruce. We've got a couple of questions in the chat right now, and we've got about 5 to 7 minutes for Q&A. Matt Enright says, I've seen fierce competitor health systems collaborate around COVID during the pandemic. Do you see this collaboration continue post-pandemic? And if yes, in what ways?
Yeah, so good question. I do see that, and because I think, as I alluded to earlier, scope and scale is important, and it is certainly important in times of crisis. And so you saw all the merger acquisitions activity prior to the pandemic. I do think you're going to see that post-pandemic, but you're going to see a lot of organizations say, I'm not ready to go down that road. My governance isn't ready to go down that road. But there are some opportunities for us to collaborate with joint operating agreements. And so let's just use telehealth as an opportunity. Most organizations now have said, I've got to have intensivists and hospitalists in the building 24 hours a day, 7 days a week, or at least handy. And to hire intensivists and hospitalists to do that work is a lot of money for organizations, and especially like in times of where resources are short. Well, again, two organizations in the same town could say, well, can we put a company together for hospitalists and intensivists and do a virtual ICU and staff that ICU with nurse practitioners maybe in the evenings, if it's not too big of an organization and too complex of an organization for hospitalists and intensivists to have nurse practitioners, and we'll put a company together to set up that telemedicine company or telehealth, tele-ICU, virtual ICU, virtual hospitalist company. There are a number of things the hospitals could get together and again, do an assessment of how many nurses do we need, how many nurse techs do we need, or other type of technical roles, and put together a company that trains those individuals from both hospitals within the community. You're going to need more home health care techs because the future is about providing services in the home. It's not only about keeping people out of the emergency room and keeping them out of the acute care setting, it's about keeping them out of the physician office. And with all the chronic care that we had with the aging population prior to the pandemic, and now the pandemic has created these long haulers for many other chronic conditions that they're going to carry for the rest of their life, we're going to have to train a group of professionals that teach family members and the patients themselves how to care for themselves in the home environment. So again, these joint operating agreements, not merger, for educating the workforce, educating these new skills, or actually providing services in a new company. And at sometimes, maybe over time, it morphs into a more a different type of relationship. But there's plenty of opportunities to collaborate. And one I didn't touch on, I touched on a little bit, but I didn't take a deep dive into. Healthcare organizations within the same community better figure out how to connect with public health and these social agencies to handle the social disparities within the communities and how they work together. Because if they don't, these patients are going to continue to show up on their doorsteps, and they're going to be caring for them in a more expensive environment than they could if they had all worked together.
Chuck. This is Bruce again. We may have time for one more question, and then Trent Lind will close us out. And we had one comment about will your slide deck be shared? And later on today, I'll send out an evaluation with the slide deck and a few other things for you. Regarding your comment about employee-physician engagement, Sharice Braxton shared that Kaiser Permanente offered staff and providers stipends for childcare since April 2020. The stipends have been just been extended until March 2021, and they are offering up to 2 weeks of pay if you have COVID while you recover at home.
Right, that's great, great idea. And again, back to the previous question, where's an opportunity to collaborate? That's it. Two healthcare systems. Again, you look at the workforce, the majority of the workforce are women. Childcare is imperative. If you don't have somebody taking care of your child, there's a high probability you're not coming back to work. And so two healthcare systems could get together and either contract with an existing childcare agency or agencies in town, or they just say, hey, you know what, this going forward, this is something that we're going to have another pandemic, we're going to have another crisis. Why don't we offer childcare as a system to our employees? And they know that it's a high quality, a high reliability childcare. That would be so comforting to your workforce. And not only could you two organizations do it, but you might get your foundation to even fund some of that.
All right, thanks, Chuck. I think we're gonna have to wrap it up, and I'll send it over. Well, if you have any closing comments, if not, we'll send it over to Trent to close us out.
Oh, it's been great being with you, and I appreciate the opportunity to be with you today. And you all have a very safe and happy New Year.
All right, Chuck, thank you so much. I apologize in advance. I was actually on a COVID call that I could not get off with our company. Just, again, I think dealing with the same stresses we've been dealing with for the past 9 months. That said, it's really just, I did get a chance to hear most of your comments today. Really appreciate your time that you spent with our chapter and our membership today, walking us through your insights, because no doubt we've been in this really reactionary phase for many, many months. And as much as we've tried to be proactive, dealing with, for many of us, the first global pandemic we've dealt with in our careers, it's really, truly been an experience to go through. And to think going forward in our post-pandemic world, how we can be more proactive moving forward, and how we can really take the lessons we've learned, look at the challenges that we face going forward with open eyes, but also look at the positivity that's brought. Really, really appreciate those insights as well. Excited, and I think you would love to hear this. We are heading down a new path as a chapter. We'll be soon announcing a partnership that we're putting in place with our National Association of Health Services Executives to develop a GAHE partnership formally, which will have a diversity and inclusion committee as part of that, and a board member from NACI on board with us on our board at GAHE. So really excited about that. And that's just another example of how we can really better be proactive going forward to deal with the challenges in this post-pandemic world.
That's terrific. Congratulations. That's awesome.
Well, thank you so much. I also want to say a quick shout out and thanks to Apollo MD for being our sponsor today. I think as everybody knows, we can't put these events on without amazing sponsors. So truly appreciate Apollo MD. Obviously appreciate all of our Georgia leadership that's out there. I tell you what, I think we all give virtual round of applause to our leaders that day in and day out, get out there and fight the fight for us to enhance our healthcare in our communities, and also respond to the challenges that we face daily. Make sure that you get out there and fill out your evaluation. We really need your feedback to make sure that these events that we put on, especially special occasions like this with Chuck and his time that he spent with us, that you're getting what you desire out of it, because our membership is only as good as our offerings. And so we want to make sure that we offer the best possible. I know my review is certainly an A+, so we appreciate Chuck spending time with us today just to give us his feedback and glimpses of leadership opportunities. Beauty of this is a qualified hour as well. So I know that we're all eager to continue to develop ourselves from a personal perspective, a professional perspective. It's certainly having those qualified hours and the partnership we have with ACHE, having afforded us the opportunity to put on events like this and access those qualified hours is fantastic. So more will come out about that. You go to the website also and make sure you get those credits in place. And then really last but not least, just again, a big thank you and shout out to all our leaders out there in Georgia. You know, GAHE continues to be really a #1 leader when it comes to our associations. We were the second largest association again across the country, and have a really large geographical coverage area. And you know, I think in these times where we've stepped forward as a chapter, and our board and those volunteers that represent have stepped forward in a big way to really offer these tremendous educational sessions online. It's developed us in a much deeper way. And chapter-wise, we're seeing growth in areas across the state that we've never seen just because the access is there. And so, again, thank you so much for what you do, and we will continue to offer great and tremendous offerings from an educational perspective going forward. So make sure you keep tabs online and within social media of those future events. Thank you so much.
Thanks, Trent. Thanks again, Chuck. Great session.
Great. Thank you. Have a good one. Bye-bye.
Hey, thanks again, Chuck. Appreciate it. Sorry I missed the beginning.
Absolutely. Take care.
Hey, you too. Thanks, Bruce.
Sure thing, Trent.